Hello, friends. Can your feet give clues to your health? This is the topic we are going to discuss. I am Dr. Jagajit Singhvir, MBBS, FCGP, FAMS, PGDGM. Foot pain. When feet ache after a long day, you might just curse your shoes. After all, 8 out of 10 women say their shoes hurt. But pain that's not due to sky-high heels may come from a stress fracture, a small crack in a bone. Exercise that was too intense, particularly high-impact sports like basketball and distance running. Weakened bones due to osteoporosis increases the risk of foot pain. Smelly feet. Smelly feet, called hyperhidrosis, tend to cause more alarm than most foot symptoms. Odor, even downright stinginess, is seldom a sign something physically amiss. Feet contain more sweat glands than any other body part, 500,000 between the two of them. Some people are more prone to sweat than others. Add in the casings of shoes and socks, and the normal bacteria that thrive in the body have a feast on the resulting moisture, creating the smell that makes wives and mothers weep. Both sexes can have smelly feet, but men tend to sweat more. Red, white, and blue toes. Raynaud's disease can cause toes to turn white when there is decreased circulation, then bluish due to cyanosis, and then redden again and return to their natural tone. The cause is a sudden narrowing of the arteries called vasospasm, which restrict circulation. Stress or changes in temperature can trigger vasospasms, which usually don't lead to other health concerns. Raynaud's may also be related to rheumatoid arthritis, Sjogren disease, or thyroid problems. Inability to lift front part of foot, called foot drop, and is caused by paralysis or weakness of the muscles that lift the foot. This condition may signal a number of underlying disorders, such as neurodegenerative disorders, multiple sclerosis, stroke, cerebral palsy, polio, amyotrophic lateral sclerosis, or other muscle or nerve disorders. Treating the underlying conditions may reverse the symptoms. Heel pain. Most common cause of heel pain is plantar fasciitis, inflammation where this long ligament attaches to the heel bone. The pain may be sharpest when you first wake up and put pressure on the foot. Arthritis, excessive exercise, and poorly fitting shoes cause heel pain, as can tendonitis. Less common causes a bone spur on the bottom of the heel, a bone infection, tumor, or fracture. This is the inflammation of the heel. This is the fascia, and this is the attachment with the heel, and this is inflammation at this point. And the spur also occurs here. protrusion of a bone part. Cold feet. If your toes are always cold, could be poor blood flow, a circulatory problem, sometimes linked to smoking, high blood pressure, or heart disease. The nerve damage of uncontrolled diabetes make your feet feel cold. Other possible causes, hypothyroidism and anemia may be there. A doctor can look for any underlying problems or let you know that you simply have cold feet. Dragging your feet. Sometimes the first sign of a problem is a change in the way you walk, a wider gait or slight foot dragging. The cause may be the slow loss of normal sensation in your feet brought on by peripheral nerve damage. About 30% of these cases are linked to diabetes. Nerve damage also can be due to infection, vitamin deficiency, and alcoholism. Many cases, no one knows what caused the nerve damage. Other possible causes include problems with the brain, spinal cord, or muscles. Clubbing in toes. In clubbing, the shape of the toes and often the fingers changes. The nails are more rounded on top and curved downwards. Lung disease is the most common underlying cause, but it also can be caused by heart disease, liver, and digestive disorders or certain infections. Sometimes clubbing runs in families without any underlying disease. This is the clubbing. This part, just like convexity upwards. Swollen feet. This is usually a temporary nuisance caused by standing too long or a long flight, especially if you are pregnant. Feet that stay swollen can be a sign of a serious medical condition. Cause may be poor circulation, a problem with the lymphatic system, or a blood clot. Kidney disorder or underactive thyroid can also cause swelling. If you have persistent swelling of your feet, see a physician. Burning feet. A burning sensation in the feet is common among diabetics with peripheral nerve damage. It can also be caused by a vitamin B deficiency, athlete's foot, chronic kidney disease, poor circulation in the legs and feet. Peripheral arterial disease is called, or there may be hypothyroidism. Wounds that don't heal. Foot sores that will not heal are a major warning signs for diabetes. Diabetes can impair sensation in the feet, circulation, and normal wound healing. So even a blister can become a troublesome wound. Those sores also are prone to infection. Diabetics should wash and dry their feet and check them for any wounds every day. Slow healing of sores also can be caused by poor circulation from conditions such as peripheral arterial disease. Pain in the big toe. Gout is a notorious cause of sudden pain in the big toe joint, along with redness and swelling. Osteoarthritis is another culprit that causes pain and swelling. If the joint is rigid, it may be hallux rigidus, a complication of arthritis where a bone spur develops. Turf toe is an ailment of athletes, particularly those who play on hard surfaces. It's caused by an injury to ligaments surrounding the joint. Pain in the smaller toes. Feel like you are walking on a marble, or pain burns in the ball of your foot and radiates to the toes. You may have Morton's neuroma, a thickening of tissue around a nerve, usually between the third and fourth toes, 8 to 10 times more common in women than in men. caused by injury or too much pressure on the toes. This is that. This one is neuroma. These are nerves and this is swelling. Itchy foot. Itchy, scaly skin may be athlete's foot, a common fungal infection, a reaction to chemicals or skincare products that's called contact dermatitis can cause itching too, along with redness and dry patches. Skin on itchy feet is thick and pimple-like. It may be psoriasis, an overreaction of the immune system. Medicated creams can relieve the symptoms. Claw toe. Foot deformity can be caused by shoes that are tight and pinch your toes or by a disease that damages nerves, such as diabetes, alcoholism, or other neurological disorders. Toes will be bent upward as they extend from the ball of the foot, then downwards from the middle joint, resembling a claw. May respond to stretching and exercises of the toes, or you may need special shoes or even surgery. These are like that. These are claws. Yes, bending. This is also a claw. This is also a claw. This is also a claw. Foot spasms. Sudden sharp pain in the foot is the hallmark of a muscle spasm or cramp, which can last many minutes. Overwork and muscle fatigue are common causes. Other causes: poor circulation, dehydration, or imbalances in potassium, magnesium, calcium, or vitamin D levels in the body. Changing hormone levels of pregnancy or thyroid disorders may play a role. Spasms are frequent or severe. See a doctor. Strengthening exercises can help with muscle fatigue. These are spasms. Dark spot on the foot. Associate skin cancer with the sun, so we are not as likely to check our feet for unusual spots. A melanoma, the most dangerous form of the skin cancer, can develop in areas that are not regularly exposed to the sun. So it is a misnomer. Melanoma can even appear beneath the nail, where it might look like a black spot. This is a black spot. Yellow toenails. Toenails tell a lot about your overall health. A fungal infection often causes thickened yellow toenails. Thick yellow nails also can be a sign of an underlying disease, including lymphedema, swelling related to the lymphatic system, lung problems, psoriasis, or rheumatoid arthritis. These are those. Spoon-shaped toenails. Sometimes an injury to the nail or frequent exposure to petroleum-based solvents can create a concave spoon-like shape. However, iron deficiency also can cause this unusual shape. This is like that. This is that spoon shaped. White nails. Injury to the nail or illness anywhere in the body can cause white areas in the nails. Part or all of a nail separates from the nail bed. It can appear white and may be due to an injury, nail infection, or psoriasis. Nail is intact and most of it is white. It can sometimes be a sign of a more serious condition, including liver disease, congestive heart failure, or kidney disease. Talk with your healthcare team about any concerns. These are that. Pitting of the nails. Pitting or punctured looking depressions in the surface of the nail is caused by a disruption in the growth of the nail at the nail plate. Affects as many as half of people with psoriasis. This is that. Thank you very much.